Hello and welcome to Americares Year in Review. My name is Jed Selkowitz, Americares Senior Vice President of Communications. I'm joined by Americares President and CEO Christine Squires and Vice President of Emergency Programs Kate Dischino. 2020 has challenged all of us, but Americares continues to meet that challenge. We are responding to multiple disasters, including the COVID-19 pandemic, with the goal of increasing access to healthcare for low-income, uninsured people in the United States and around the world. Today, we'll take a look back at 2020 and hear from Christine Squires and Kate Dischino about the work Americares, our partners, and health workers in the United States and around the world have been doing in one of the most challenging years in our lifetime. Christine, you became Americares President and CEO at a unique moment. Your first day as President and CEO was March 14th, right when COVID-19 shut down just about everything, including Americares headquarters. So the pandemic has really shaped your tenure as CEO. How has Americares responded to COVID-19?
Well, you're right. My transition to CEO certainly didn't happen the way I imagined. I don't think any of us imagined what our lives would become. My first task as CEO was to tell 500 Americares global staff not to go to their offices, but at the same time ask them to work harder than ever to slow the spread of COVID-19 and to help protect health workers. A major area of focus for us has been supporting frontline health workers who are continuing to fight this uphill battle. COVID-19 infections and deaths have skyrocketed around the world. This disease has killed over 1.6 million people worldwide and more than 300,000 people in the US. Over the past year, Americares has used every resource to fight this pandemic, to keep health workers safe on the job and make sure people affected by poverty or disaster get the care they need. Americares' COVID response addresses three key areas: providing critical supplies, access to ongoing health services, and skills training and support for health workers. We've provided millions of personal protective supplies to thousands of health workers around the world. In addition to ensuring health workers have supplies, training is so important. Our trainings give health workers the tools they need to stay safe and healthy and safely treat patients during this pandemic. We've also shared the facts, like the benefits of wearing masks, social distancing, and hand washing to keep the public informed. And Americares clinic staff around the world in Colombia, El Salvador, India, and the US made the pivot to telehealth at the outset of the pandemic, ensuring continued care for their patients. Finally, when it was safe to reopen, our clinic started seeing patients under strict safety guidelines.
What does COVID-19 response look like going forward?
In 2021, we're going to continue working where Americares can have the most impact, supporting health workers and clinics that serve the low income and uninsured. That's always been Americares' strategy, to strengthen local health centers and the communities around them. It's more complicated now during this pandemic, but it's our goal every day. We're also exploring opportunities to play a role in supporting COVID-19 vaccination efforts, and we'll continue providing medicines and medical supplies and support health workers. We'll be prioritizing our work in mental health and psychosocial support. As a result of this pandemic, mental health issues associated with it will last years, and without support, it can be debilitating. Right now, in Americares mental health workshops, we teach health workers how to identify and manage the stress and anxiety and trauma they see in their patients arising from the COVID-19 pandemic. And we give health workers the resources they need to address their own mental health needs, to help them deal with the immense stress they are under, a stress that has lasted far too long.
Christine, you raise a great point. I'd like to bring in Kate Dischino. Kate is our Vice President of Emergency Programs. Kate, can you elaborate on Americares' work training health workers?
Absolutely, Jed. Over the past year, Americares emergency programs teams have really stepped up our trainings. Trainings provide information and build skills that keep health workers and their patients safe. Like Christine said, our instructors cover preparedness, mental health and psychosocial support, infection prevention and control, and water sanitation and hygiene. It's essential that health workers have these skills. In August, Hurricane Laura came ashore in Louisiana and Texas. The storm wrecked homes and businesses and forced thousands of survivors into shelters. In Lake Charles, Louisiana, The SWLA, Center for Health, suffered immense structural damage, but its health workers really just rose to the occasion. They transported people to evacuation centers before the hurricane, sheltered families in the undamaged parts of the clinic during the storm, and when the storm passed, they proactively checked on people who had sheltered in place. Last year, that team learned these strategies in one of Americare's preparedness workshops. We know SWLA, like so many other health centers, have a long recovery ahead, and we'll be there to help. But we hope that with these trainings and tools, we've improved survivors' lives. Usually, our teams conduct these trainings in person, but due to COVID-19, we've had to shift, and one of those shifts has been to virtual workshops. And we've still managed to train thousands of health workers around the world.
Kate, you alluded to this, but in a normal year, Americare's relief workers would deploy around the world to respond to disasters. But with stay-at-home orders in place and just for general safety, Americare's has had to shift the way we respond. How has COVID changed the way your teams have worked?
You're right, we've certainly had to adjust, but we're always flexible in everything that we do. Every response is different, so we always are ready to adapt. Last year, Americare's responded to 41 emergencies, including ongoing responses from previous years. That's because we make sure our programs are in place for as long as they're needed, as long as we can help restore health services for survivors. As you know, Jed, Americare saves lives and improves health for people affected by poverty and disaster. And this year, everyone is at risk during this pandemic. But the most vulnerable people in every disaster are those living in poverty. Americare's has a large partner network that serves low-income, uninsured, and underinsured people. And that's allowed us to work with nonprofits, health centers, and ministries of health all around the world to address health needs following disasters, and that includes access to medicines and supplies. Our donations have been distributed and used at many levels, and this ranges from state and city level organizations to partner clinics to community-based organizations. And while we've been distributing medicines and medical supplies from our own distribution center, we've also sourced these products locally. And we've ramped up our operating support for health centers impacted by disaster. That includes support for items like temporary water trucks for potable water and hand washing stations so that health centers who are damaged by wildfires or hurricanes have the items they need. And throughout all of this, we've employed our partnership network to work alongside other community organizations and really tailor hyper-local responses.
This year saw the most named storms in one season. The last hurricane of the season, Iota, was the latest in the year that any storm had reached Category 5 status, eventually making landfall as a powerful Category 4 hurricane. How has Americare's responded to this historic hurricane season?
This has been an incredibly active hurricane season. Not only have there been more storms this year, but multiple storms have hit the same communities. Earlier, I mentioned Hurricane Laura. Hurricanes Laura and Delta came ashore on the coast of Louisiana within just weeks of each other. And Hurricane Iota made landfall in Nicaragua just 15 miles from where Hurricane Eta had hit just 2 weeks prior. This has forced thousands of families to be affected by these back-to-back and powerful storms. Americare's partnered with organizations throughout the US and Latin America to get essential medicines and relief supplies, including personal protective equipment, into the hands of people who need it most, health workers and families staying in evacuation shelters. Anytime families have to flee their homes is an utmost tragedy. But with COVID-19, staying in close quarters of an evacuation shelter just adds extra layers of stress and risk. We've also provided operating support, technical assistance, and training to impacted health centers. And our emergency teams have worked closely with our local partners to respond to their unique needs and make sure that our response is tailored to the situation on the ground.
Great, thanks, Kate. Christine, in the US, Americare supports a network of nearly 1,000 clinics and health centers serving more than 7 million patients in need. Can you tell us a little bit more about what Americare is doing for these clinics? How are we helping them?
Yes, with the number of families in poverty rising nationwide, clinics around the country are seeing an increase in new unemployed patients. And as you said, Jed, supports safety net health centers, such as free and charitable clinics, who support this patient population. We know the working poor are most at risk. Black, Native American, Latino, and Latina people who already suffer inequitable care are also most at risk. And this pandemic has forced millions of Americans to lose their jobs. That means millions more newly uninsured people who rely on free and charitable clinics for healthcare. These clinics do phenomenal work, but this is a huge influx of patients for clinics that were already stretched to meet needs before the pandemic. So Americares is investing in these local health centers. Americares is already the leading nonprofit provider of medical aid to the U.S. healthcare safety net. Just last year, we provided $230 million in health programs, medicine, and medical supplies to our U.S. safety net partners. Even if clinics have the resources to buy these supplies, they often can't find them available, and that's where we come in. And without masks and gloves, clinics would have to close their doors, and that's been the challenge this year. In addition, this year, these safety net clinics that millions rely on have seen their budgets shrink. So we've provided cash support to our trusted partners so they can keep their doors open and help more people in need. We know health services are needed now more than ever by more people than ever, and we want to meet that challenge.
That's amazing. Thank you, Christine. Americare's health programs and medical donations reach an average of 90 countries each year, and we carry out ongoing health programs in over 20 countries. Christine, what international work stands out for you from 2020?
I'm proud of so much of our work. We support over 4,000 health centers globally and their staff and surrounding communities. And we have decades of deep experience in response and preparedness. And I'm proud of how nimble and creative our teams have been in the face of this pandemic. So a few things have stood out to me in 2020. In India, as soon as the pandemic hit, our team in Mumbai activated to make sure their patients had at least 3 months of medication in their hands as they headed into lockdown, so they could keep their health conditions under control. We also trained volunteers to spread messages about good nutrition, hygiene, and health habits to their communities. In Peru, we're working to deploy mobile medical teams and put doctors and nurses into health centers and communities with extremely high rates of COVID infection. And we all know that communities depend on clean water to prevent infection. So we installed hand washing stations in water tanks in Malawi and Tanzania. And of course, we provided critical protective supplies to health workers around the world. When supplies were low and health workers were worried whether they'd have the supplies to stay open, Americares met that challenge.
Kate, I want to bring you back into the conversation here. You've mentioned Americare's work around the world and also the challenges in terms of deploying our staff from the United States. Does Americare's ever deploy local staff during emergencies around the world?
That's a great question, and we absolutely do. Staff from Americare's offices around the world and our global emergency response roster are just instrumental in our local emergency responses. Our emergency response roster members and professionals are trained in Americare's emergency response programming. They're experts in their field who can provide essential health services in disaster-affected communities. And this year, our global staff have really taken the lead on executing most of Americare's in-country COVID work. And even beyond COVID, Americare's regional teams are often amongst the first on the ground after any major disaster, delivering essential health services and supplies to partners. Here's one example. In November, back-to-back typhoons devastated communities across the Philippines. In response, Americare's deployed teams of our locally based experts, including medical personnel from both our Manila office and our global roster. Our teams distributed critical medicines, hygiene kits, protective gear, bottled water, and water purification tablets to adapt to all the local scenarios. And we held awareness sessions on hygiene. Americare's also provided medical supplies and equipment to damaged health centers.
Thanks, Kate. I was in the Philippines in February and had the privilege of seeing the work that our team locally there does, and it's incredible. So thank you for that. Christine, how has Americare supported moms and kids in 2020? Any highlights?
Absolutely. So Americare's maternal and child health programs build stronger lives around the world. But just to touch on one highlight from October, Americare's launched a groundbreaking program to promote respectful maternal care at health facilities in Liberia and Tanzania. And our goal is to increase the number of children and expectant mothers using those health services. Healthcare-related disrespect and abuse during pregnancy and childbirth significantly decrease a woman's likelihood of using health services. We know this is a major barrier to care, but until now, few projects have comprehensively addressed its root causes. Americares has partnered with traditional midwives, community health volunteers, and community leaders on women's and children's health programming in Liberia and Tanzania for years. So this new program will allow us to take that work even further by integrating respectful care practices into existing services and empowering women to seek the services they need.
It's such an exciting initiative, Christine. I'd love to actually take just one more minute to discuss it. What exactly will Americares be doing to promote respectful care?
Our staff will mentor health workers in at least a dozen facilities in each country to improve their skills to build trust so more women seek care, ultimately saving the lives of mothers and babies. For example, health workers will learn how to counsel women and families on their right to respectful care, and they'll encourage women to deliver with skilled attendants, seek family planning services, postnatal care, and nutrition counseling. Plus, health center staff will receive training in managing pregnancy and childbirth complications. And as a result, our hope is that we can build the bridge of trust in the communities and have healthier babies and moms.
It's amazing. Kate, you've spoken about how Americares has focused this year on keeping health workers safe during COVID, but how has Americares kept its own employees safe?
That's a great question, Jed. I think this year we've all made changes to keep ourselves and our community safe. As Christine and I had mentioned earlier, most of our staff have been working from home since the beginning of the pandemic, but there are Americares employees on the front lines of our response to COVID-19. And this includes our distribution center staff and our health workers at Americares clinics. And despite the difficult conditions, our staff have just worked around the clock to put plans, safety measures in place, and adapt our health service delivery. And our distribution center staff have really ramped up the number of shipments to address a growing need. And thousands of health workers and patients are safer and healthier because of their diligence. To help keep them safe, Americares has revised our own safety procedures. Our clinic staff and distribution center teams are practicing social distancing. We've equipped them with items like with personal protective equipment. And when possible, our appointments at our clinics in El Salvador, Colombia, India, and here in Connecticut are done through telehealth. And even further, the distribution center staff have created a new schedule to reduce the number of staff on site at any given time.
Christine, I'd like you to elaborate on something Kate just mentioned, telehealth. You've mentioned a few times that because of the pandemic, Americare's clinical staff has had to make the switch to telehealth. How has that worked for those teams?
Thanks, Jed. I'm so proud of the work our health providers have done throughout the COVID pandemic. And adopting telehealth was new for many, but they really rose to the occasion. So here's one example. Before the pandemic, our community health workers in El Salvador would visit patients in remote rural communities to monitor their vital signs and provide important health guidance. But when El Salvador implemented a strict quarantine, buses weren't running, and our teams couldn't travel to those villages. So they immediately pivoted. They provided care by phone, videos, WhatsApp messages, and voice calls. And thanks to their quick work, patients living in even the most remote communities continue to receive care. So when patients had no access, telehealth provided patients with continuity of care where it didn't exist. And here in Americare's home state of Connecticut, COVID-19 shut down most businesses in March. Americare's free clinics in Connecticut immediately switched to telehealth. Our clinics found that frequent telehealth check-ins are very effective in patients managing their chronic diseases. and they don't have to travel or take off from work to get the medical care that they need. And as we look forward, we see telehealth in combination with in-person visits a way to reach more patients in low-income communities.
Great. Kate, shifting gears a little bit, it's been a tough year for California with so many wildfires. Can you speak to how Americares responded to the wildfires in California earlier in 2020?
Of course, this has just been another example of back-to-back and tough year for California. This fall, wildfires raged throughout the Western United States. They burnt millions of acres of land, covered the region in smoke, and displaced tens of thousands of people, even leading to dozens of deaths. Americares, in response, committed $2.5 million in relief. We provided emergency shipments of medicines and relief supplies, including protective gear, to health centers in the area that were responding, and provided cash assistance to displaced families and operating support to health centers that are struggling just to keep their doors open. Sadly, we know the wildfires are growing more common and even more destructive. So we've expanded our team of emergency response experts, and we now have staff that are actually based in California to strengthen health center resilience and carry out our local response strategy. Last year, we launched a robust disaster preparedness and mental health initiative to help health centers in fire-prone communities better prepare for and respond to fires and other emergencies, of which California faces many.
Thank you, Kate, and thank you, Christine, for your time and taking a look back at 2020 and the health-focused activities of Americares and our partners. Christine, do you have any final thoughts as we begin to wrap up?
Yes. So you said at the outset of this call, Jed, that 2020 has been a year like no other. And it's true. We've seen significant challenges, but also remarkable successes. And if this year has proven anything, it's that health is fundamental. Looking back on 2020, I'm so proud of our Americares work and our team. And even under the most difficult circumstances, we are improving health and saving lives of millions of people around the world. And I want to thank all of our supporters for enabling this work. And I'd like to share one example of the impact your support has had in one specific clinic. So earlier this year, we sent personal protective equipment to a neighborhood clinic in Tacoma, Washington. At the time, neighborhood clinic was seeing an influx of patients who had recently lost their job and their health insurance because of the pandemic. These include former bartenders, restaurant workers, and hairstylists. Neighborhood clinic needed to remain open, and patients depend on the care they provide. But at the time, neighborhood clinic didn't have enough protective equipment. They were worried they would run out of gowns and masks. So when Americare supplies arrived, their clinic coordinator, Josephina, tells us how important these supplies were. She said, Americares is helping us keep the doors open and serve this bigger community too. It's just humans helping humans to have a better life. And there are hundreds more examples like this. As you know, that's what Americares is all about, saving lives and improving health. And we couldn't do that without the support of the people who've joined this call. So I just want to say thank you, and I am so grateful to have you on our team. Americares has had a strong 2020, but our work continues in 2021 and beyond. We know we need to do more than ever together, and we can do more. We look forward to the challenge in the new year.
Thank you, Christine. And thank you to everyone for watching and for supporting Americares in 2020. If you'd like to learn more about our health programs, please visit americares.org and sign up for our email alerts to stay connected. Please, in the meantime, stay safe and stay healthy. Thank you.